Everybody knows that human health is a very delicate thing that can be easily lost. Nobody is insured against it. Every one of us may fall in such a situation. Because of traffic accidents, a person may perish or become invalid for whole life. Unhealthy habits like smoking, abuse of alcohol, irregular or poor nutrition may affect heart vessels and provoke their constriction and congestion. It may cause destructive effect on heart and lead to severe consequences like extensive infarction and a difficult operation. Unfavorable ecological environment and unhealthy habits may damage blood vessels of body extremities, veins and arteries. Very often, it may result in vessel congestion and provoke painful symptoms that lead to amputation of fingers or the whole extremity. Nowadays, more and more men face with such a problem as sterility that can be a grave obstacle for a happy family life. Many of us have not only heard about such a grave disease as diabetes, but also know in person to which severe consequences it may lead. In pregnancy or in early infantile age, a young growing organism may be affected by various harmful factors that lead to severe diseases. Such diseases may become apparent as time goes by, but it does not make them less painful. Conventional methods of modern medicine don't allow to help successfully such patients for the time being. But it is not worth losing hope even in such difficult situations. Medical science is constantly developing, and nowadays there's a real possibility to improve patients' health and even heal them. These are words of doctors who are specialists in reconstructive or regenerative medicine. It's a new branch of medicine that worked out new methods for treatment of severe diseases with use of stem cells. Many of you have probably heard about stem cells, but also many of you do not fully understand what are stem cells and how do they work. Researchers on stem cells is a promising branch of medical science. Such researchers encourage scientists to find ways of treatment of severe diseases with use of stem cells therapy. This branch of medicine is often called regenerative or reconstructive medicine. Nowadays, stem cells represent one of the most attractive branches of biology. But like many other branches of science in way of development, researchers on stem cells give rise to new questions as fast as they give birth to new discoveries. Stem cells have two important characteristics that distinguish them from other cells. Firstly, stem cells are undifferentiated cells that undergo the process of self-renovation during a long period by means of proliferation. Secondly, under certain physiological or experimental conditions, stem cells can be stimulated to become cells with special functions like cells of cardiac muscle or insulin-producing cells of pancreas. Scientists mainly work with stem cells of two sorts: cells of animal origin and cells of human origin. Human stem cells can be embryonic or adult. They have different functions and characteristics. More than 20 years ago, scientists discovered ways of getting and secretion of stem cells out of mice embryos. Years of detailed studies on mice permitted to discover in 1998 the ways of secretion of stem cells out of human embryos and the methods of their cultivation in laboratory. Such cells are called human embryonic stem cells. Embryos used in those researches were created by in vitro fertilization. When scientists did not need the embryos anymore, in accordance with donors' agreement, they passed the embryos for further researchers. Stem cells can be obtained from a fetus, perished in abortion. Such stem cells are called fetal. One more source of stem cells is cord blood. In 1960s, scientists discovered two populations of stem cells of bone marrow of adult persons, so-called homeopoietic and stromal cells. Too much later, it was discovered that minor quantities of stem cells are found in all organs and tissues of adult persons. Stem cells are very important for a live organism because of many reasons. One of the main reasons is that stem cells originate many types of specialized cells that create heart, lungs, skin, and other tissues. In some adult tissues like bone marrow and muscles, populations of adult stem cells generate replacement for the cells that were lost due to injuries or diseases. Scientists offered a hypothesis that stem cells could be the basis for treatment of many severe diseases like Parkinsonism, diabetes, and cardiovascular diseases. Stem cells differ from other sorts of cells in organisms. Independently of their origin, all stem cells have three main properties. Firstly, stem cells can proliferate and renew during a long time. Secondly, they are not specialized. Thirdly, they can change into other specialized types of cells. Scientists try to understand two fundamental properties of stem cells that concern their ability to self-renew during a long period of time. Namely, how can stem cells proliferate in laboratory and do not differentiate at the same time? And what are the factors that normally regulate the process of proliferation and self-renovation in a live organism? When stem cells divide and multiply themselves many times, we call this process proliferation. When stem cells change into a special type of cells, we call it differentiation. Scientists just begin to understand the signals inside and outside the cells, the signals that launch the mechanism of differentiation of stem cells. It was determined that the internal signals are controlled by the genes that are disseminated along all DNA chains. They carry on encoded instructions about all structures and functions of a cell. External signals that have an influence on cells' differentiation include chemical substances synthesized by other cells, physical contact with adjacent cells, and molecules on intercellular liquid. Some time ago, scientists thought that only embryonic stem cells are able to change into any cells of organs and tissues of organisms, and that is why they carried on researches mainly on embryonic stem cells. But numerous experiments allowed to discover that stem cells of an adult organism can change into almost any type of cells of human organism. At the present time, scientists are already able to act in laboratory upon stem cells of bone marrow of an adult person in a way to get cells of liver, cardiac muscle, neurocytes, etc. This unique property of stem cells is called flexibility. The most promising stem cells of an adult organism are the cells of stroma of bone marrow. In particular, thanks to this flexibility and to the fact that stromal stem cells are quite easy to be secreted, they became a basis for elaboration of a unique method of treatment created by scientists and doctors that work in Kharkov city. In the year 2003, Kharkov Institute by Biotechnologies of Cells started scientific researchers on new methods of medical treatment of human diseases and their application into practice. Such researchers are based on the most modern medical technologies. One of the main lines of our scientific activity is elaboration of new methods for treatment of severe human diseases with help of stem cells of bone marrow. We work exclusively with proper cells of our patients. That is why there are no moral and ethical problems concerning the origin of stem cells. There are no immunological problems of cells rejection at all. Specialists of our institute have elaborated a unique method called autotransplantation of stem cells of bone marrow. Please pay your attention to the fact that the matter concerns the transplantation of the proper cells of a patient. The cells that previously were taken from the patient and after special treatment in laboratory will be injected to the same patient. That is why we use the word autotransplantation, that means transplantation for yourself. The essence of the method is the following. We intake 2 cubic centimeters of bone marrow out of the wing of patient's iliac bone. After that, we cultivate stem cells in laboratory. If necessary, the cells can be induced for further differentiation into nerve cells, liver cells, or cardiac cells. On final stage, the cells are injected to the patient. According to type or gravity of the disease, the cells may be injected either into the blood flow, intravenously and intra-arterially, either locally, intra-articularly and intrafascially, or during the operation as suspension or autograft. The course of treatment lasts about 1 year and foresees 3 or 4 procedures of autotransplantation of stem cells of bone marrow. Duration and quantity of autotransplantations may vary accordingly to the patient's state and the gravity of disease. Specialists of our institute, in collaboration with the leading specialists of Kharkov City, executed some operations that do not have analogues on patients with different pathologies. In 2004 was accomplished recanalization of obliterated vessels of lower extremities after 1 intravenous injection of the automedication based on stem cells. In 2005, for the first time in the world, we made a human spinal cord reconstructive operation using autoneuro graft. In the same year, during 3 months, we restored a full coronary blood flow to the patient who had been stent operated after myocardial infarction with ischemic syndrome. During 5 months, we restored a refined part of myocardium 9 cm wide and 4 cm long that was diagnosticated as post-infarction aneurysm. We achieved this result by intravenous injection of cells, not by intracardiac introduction. Our experience proves that therapy by proper stem cells of bone marrow brings effective results in case of such severe diseases as spinal cord injuries, infarction, stroke, liver lesions, lesions of articulations and false articulations, obliterated vessels including diabetic angiopathies, toxic polyneuritis, sterility, and male potency abnormality. That is why the method of autotransplantation of stem cells of bone marrow can be a chance for recovery and rehabilitation for many people. The method of autotransplantation of stem cells of bone marrow is not the unique collaboration of the Institute by Biotechnologies of Cells. Our specialists created also a method of production of homeopathic stimulators of stem cells in the patient's organism, so-called homeopathic cellular stimulation. Such preparations are produced in grains or solutions. This effective method is our know-how that allows to avoid surgical intervention and achieve positive results of natural cellular therapy. Homeopathic cellular stimulation is used independently or in combination with autotransplantation of stem cells of bone marrow. We draw your attention to the fact that stem cells injected into the organism evoke the effect of revitalization, or, in other words, rejuvenate the whole organism. We do not promise to work wonders, but the practice proves that stem cells therapy, in case of severe diseases, allows to get positive results that still cannot be achieved by conventional methods of modern medicine.